Morning, North Dakota. Thank you for joining us for our press briefing on COVID. We're pleased to have a great lineup today of guests, including our Senate Majority Leader Rich Wardner, House Majority Leader Chet Pollert, Senate Minority Leader Joan Heckeman, and House Minority Leader Representative Josh Boucher. We've also have Dr. Michael LeBeau, who's the president of Sanford Health from the Bismarck region, who's going to be speaking on behalf of the North Dakota Hospital Association today. And also we've got Chris Jones here from Human Services to be available to answer questions afterwards related to hospital capacity and the teamwork between the state of North Dakota and our great hospitals in our state. Let me kick off this morning with some context about sort of where we find ourselves right now. We know that from following this pandemic last spring when it first landed in Seattle, Washington, and then the biggest outbreak in the country began through travel-related infections in the New York metro area. And we watched from afar in our country where we saw the devastation there, where states like New Jersey and New York and others had days when they were recording over 1,000 deaths per day. We've learned a lot since that time frame, but we also watched the pandemic move to the south and then to the southwest. We saw states like Arizona hit particularly hard back in July. And then as we headed back into the fall season, we've seen the COVID-19 move across the Midwest. And so we put ourselves in context in terms of North Dakota, in terms of how we're doing. I'd like to start off with a slide in terms of test positivity for the region. Because again, as you remember last spring, the upper Midwest had some of the lowest in the country. And if you can take a look at the slide that we have here, Idaho at 24% test positivity, South Dakota and Wisconsin around 20%, Iowa at 17%, Wyoming and Kansas around 15%, Nebraska 23%, Montana and Missouri at 9%, North Dakota and Minnesota among the lowest of this entire upper region, North Dakota at 7.3%. But even with North Dakota with our lowest percent positives, as we know, we are leading the nation in testing. Sometimes we're doing 3 times as much testing per capita as other states. But we did see that this week that Montana has had its record number of cases since the pandemic began in a day. Minnesota reported over 900 cases yesterday. In North Dakota with 531, that's our highest number of cases that we've had today so far in the pandemic. There has been a lot of attention nationally around North Dakota leading the nation in positive cases per capita, but I do want to assure North Dakotans that there is COVID math at work here, because we're doing 3 to 5 times as much testing per capita. Even with the lower positivity rates, and a lower positivity rate is a positive thing in this case, is that even with those lower positivity rates, substantially lower, sometimes 2 or 3 times lower than neighboring states, we are going to have a lot of positives per capita, because as we know, as we test students, as we test healthcare workers weekly, we test in long-term care weekly, we know that we're identifying more pre-symptomatic and more asymptomatic cases in North Dakota, but this early identification helps us slow the spread, even as it does drive up our cases per capita. And while we know that we are seeing some increases lately, we also know that right now, we said last week that this is a time when we said a week ago that we may be entering kind of the darkest period that we have relative to our state's experience with the pandemic. And it's been a painful week in terms of the number of North Dakotans who have passed away with COVID-19. These are our neighbors, they're our friends, they're family members, they're their loved ones, their aunts, their uncles, their sons, their daughters, their parents, their grandparents, grandparents, and we know that the loss of every North Dakotan reverberates through the communities and the families in our states. And our hearts go out to all of these loved ones, and we strengthen our resolve and our determination to stem this tide. And we know that each of us have a role to play. If we believe in liberty and care about individual responsibility, then each of us have an opportunity to make an effort, whether we're a local leader or whether we're just a parent that's a role model for our children. We each can do things every day. The transmission of this sometimes deadly disease is simple. It's undisputed that the virus can only live in people. It occurs and transmits itself from person to person. So if you're able to distance yourself from others, you will stop and slow the spread. When you can't distance, if you can wear a mask, you can stop and slow the spread. And if all of us were able to do this, be more conscious of both distancing or when we can't, making sure that we're masking appropriately in a way that we're not spreading it, we could dramatically see, even by the time Halloween got here, if we had 100% participation by every North Dakotan to say, we've seen enough evidence to see that this is deadly for vulnerable people. We've seen enough students who've been heartbreakingly missing out on either school or athletic events. We've seen enough economic impact on people to say, yes, this is real, and there's something we can do about it. And what we can do about it is the very simple things that don't require government intervention, they don't require mandates, they don't require taxpayer dollars, they don't require health officer orders, they just require each of us as individuals to do our part to help slow the spread. And so if we can do that, do it at work, business owners can do it, faith-based leaders can make sure that people are masking up when they're in church, people that are attending their students' athletic events can mask up when we're in the stands or take the opportunity just to spread out and be further apart from each other. And this is the way we can keep our kids in school, our teams on our fields, our businesses healthy, our economy going, and our government running. So again, let's all do what it takes. If we really do believe that North Dakota is special, let's show the nation that we have the ability, without government intervention, without mandates, but we really can be a state that's a role model for individual responsibility, that we can do what it takes to help us slow the spread. With that, I want to take a look quickly at the numbers. As I said, we've got some numbers that are still going in the wrong direction. Over the past week, we had 3,117 new cases. And just for my own help, I got a monitor problem going on down here we can take a look at. We've got 2,391 newly recovered cases and 54 deaths reported over the last week, which again is a tragedy in the sense that that's more than we had in some of the months earlier on during this pandemic. We're now at a 3,832 active confirmed cases. For the past week, this is a 7.6% positivity rate on a weekly basis, and again, this is substantially lower than the states around us. We are the upper Midwest region, and heading towards the Rocky Mountain West is now, if you will, the area of highest contagion in the country. But relative to our peers, North Dakota continues to perform well, and I want to thank all North Dakotans who have been doing their part to help put us in this position. We of course, work closely with the White House Coronavirus Task Force, which is led by Vice President Pence, which has from the beginning strongly advocated for robust testing programs. And again, we're pleased that the White House is taking action relative to buying and distributing to states low cost, highly accurate, and cost effective testing, which again will allow us to get results in 15 minutes at $5 a test without having to do lab or sample transports. And again, we'll be rolling those out in the coming weeks as those start to arrive in North Dakota. When we take a look at our 14-day rolling average, it continues to edge up 7.5%, but you can see this line still edging upwards. We'd like to see this flatten out and starting to go down. And we have, of course, some counties that are trending in the right direction, but unfortunately we've got more counties that are going up, that are going down. And so we need to dive below that statewide average and take a look at the specific areas. As I did mention earlier again about the people passing in the last week, as another note today, as part of the 11 o'clock just out results, there's 6 more people in North Dakota have passed today, including heartbreakingly the youngest person so far to pass away with COVID, and that was a female in the 10 to 19 age range who had underlying conditions. But again, the hearts and prayers from the First Lady and I and Lieutenant Governor Brent Sanford go out to all the family and friends who've lost loved ones during this time frame. When we take a look at the active cases statewide, we are in a position now where every single county has at least one case. And if we take a look at the cases per capita, again, this divides the number of cases by the population. You can see that where we have a high number of cases in Cass County, but large population, the rate of cases per population almost double in the Burley-Morton area and almost triple in Stark County. And so again, important to understand this. If you're someone who's working or shopping or traveling to any of these larger metro areas with larger populations, with larger number of cases, even if maybe in your hometown you may not know anybody who's ever had COVID, exercise extra caution in terms of distancing, and mask wearing, hand washing when you're heading to these areas of higher concentration, and particularly use your judgment about either skipping or avoiding areas where there's large gatherings, because we do know from our contact tracing that weddings and funerals and things that seem to be about family and seem innocent are places where we've had rapid case spreading at those kinds of events. It's my pleasure to introduce our legislative leaders, each who are going to speak together in their speech individually, but they'll all be presenting today. But I do want to just say how grateful Brent Sanford and I are for the deep and strong partnership that we've had with legislative leaders during this time frame. Never before in the history of our state have we had to distribute $1.25 billion of emergency funds during a time period that came from the federal government. The work of the Emergency Commission and the Budget Section, both which are, the Emergency Commission has a majority legislators, the Budget Section is entirely legislators, efficiently work to deliver these dollars quickly to help ensure public safety and public health, but also to ensure the economic support for individuals and businesses. And on this slide, you can see that fully 64% of the dollars which have been distributed went to economic support for individuals, and only 12% went to continuation of government services, 24% for public health and safety. And I'd say that every citizen in North Dakota should look at this chart and be proud of the work that the legislators have done, because this really represents their input. All of these leaders, I know all of them personally. We worked with them closely. They listen to their constituent caucus members. They listen to citizens in their communities. I trust you. They're not afraid to give Brent and I feedback at any time, and we appreciate that. But in addition to being great legislators, they're also parents, they're grandparents, they're business owners. North Dakota's citizen legislators, unlike the federal government, they come to work every day and they care for all of you, and they get stuff done, and they get it done across party lines, and that should make every North Dakotan proud. So with that, let me first introduce Senator Rich Wardner, and then I don't know if you guys got your batting order coming up. I think who's next is Senator Heckman, and then Josh, and then Chet. Bat and cleanup, number 4. I bet you did that growing up. Okay, Senator Wardner, great to have you here. Thank you.
Thank you, Governor, and we appreciate the opportunity for us to make some comments. You know, never before has the state in recent years had to deal with a pandemic. The legislature and the governor's office have worked through the allocating of the CARES money and funding through the following guidelines, and you've probably heard them before. The federal guidelines are we must be necessary due to the coronavirus public health emergency. So we have that one that we have to follow. It cannot be spent on any item that was in the past approved budget by the state, and it has to be something that incurred during the period of March 1, 2020 and December 30th of 2020. So we've had those guidelines. Federal auditors will be checking to make sure we follow them. So we've had some stringent guidelines in order for us to follow. With that in mind, I would like to point out that some of the categories the governor has already mentioned, but public safety was really important, and we had money going there. But I was really pleased that we put a lot of money into economic support for individual citizens and businesses. And I would like to just point out to some of the decisions we made that help both. Payroll protection plan. Not only did it help the business, but it kept the funding going to the employees, and the business could keep those employees as long as they kept them on board. So that was good for both. We also had the unemployment payments. We put $410 million into unemployment compensation. Now, it helps the business because they don't have to worry about the premiums to fulfill that bucket again. But it also helps people that didn't have a job to be able to take care of their families and themselves during this time. Also, we had $30 million that we put in extra. $30 million into K through 12, which was a help to the school district, but also to help bring on more resources for teachers because they are going through some very difficult and stressful times, as you'll hear later. And probably the last one I want to mention is that because of this funding, we were able to video conference all of the legislative committee rooms in the legislature. And that will be with us for a long, long time. That will have a lasting benefit, and that will be transparency. People will be able to watch committee hearings from at home and see what's going on in government. And lastly, I would like to encourage people to wear their masks when out in public and avoid being in large groups so we can get through this and get back to business in the state of North Dakota. Thank you.
Good morning, and thank you, Governor, for the opportunity to provide a few remarks this morning. I'm going to talk a little bit about education, about rural health care, and then the legislative session. As K through 12 education delivery continued this fall, I had the opportunity to view several school districts' smart restart plans. And I have immense amount of respect and appreciation for the work that the local administrators, staff, boards of education, parents, students, and transition teams have done to provide opportunities to assure students and staff have a safe learning environment. And to say they have met the challenge and have been nimble and responsive is an understatement. In just a few days last spring, our schools responded. In August, only a few weeks before the start of school year, our schools responded. And whether it's 100% face-to-face, distance learning, or hybrid plans, our resilient students, parents, and staff are doing their best to make sure that instruction continues. And while we can talk about all the exceptional things going on in our communities right now for education, there is still much work to do. And that work, I think, is because of COVID burnout. We have an issue with confrontation between what needs to be done and what some people think should be done and how it's being done. And that's affecting the well-being and the stress and the anxiety of our students, our staff, our parents, and the interaction between all three of those. Our school has a lot of legs on their stool, and one of them is the effectiveness of collaboration and communication. And right now, when the stress is high and there's COVID burnout, those issues are coming forward, and schools are calling and don't know how to handle that because of short-staffed, substitutes aren't available, and people like me who were in education probably aren't the best people to come in and sub right now because, first of all, we're older than average, but second of all, technology plays a part in that. And I don't know how I could manage the technology for distance learning right now without quite a bit of instruction. So those are some things going on. There's a lot of anxiety out there. And Governor, I would look forward to working with you and your staff, with educational organizations, administrators, parents, and students to figure out how to get around this anxiety right now. It has nothing to do with the funding that's out there, but maybe we need to repurpose some of the funding that has been distributed to our schools. So I think that there's an issue here that we need to address, and it's an issue we can all work together on. I also want to talk about the importance of access to health care for rural areas of our state. As a rural legislator, our rural health care involves a collaborative effort between local clinics, critical care access hospitals, EMS providers, and public health units. In conjunction with local and state law enforcement, these services are essential to the well-being of North Dakotans who live outside the metro area. The Governor's executive order that provides workers' compensation benefits to volunteers and other essential workers not currently eligible have been a great comfort for those serving on the front lines. And finally, I want to talk a little bit about our legislative session. Senator Wardner mentioned it. I think that we need to know that our leadership, legislative leadership, is working together with the Governor's office and with Legislative Council to make many adjustments that can ensure we have as normal a 2021 session as possible. The health and safety of our legislators, our staff, and the public are of utmost importance as recommendations and rule changes are developed that follow state and federal guidelines. And I want to express my appreciation to all workers across the state for your dedication and diligence in this trying time, and send condolences to the families that have lost loved ones and virtual hugs to those who have loved ones who are experiencing COVID symptoms and hospitalization right now. And thanks to the great IT staff across the state, I think Senator Wardner mentioned that, and without them, we wouldn't be able to be here today. Thank you, Governor.
Good morning, North Dakota. I'd like to also start out with my condolences to all the families throughout North Dakota who have been impacted by this virus. Shout out and appreciation to the public employees, whether it's at the K through 12 level in education or higher ed staff, our public health professionals, and of course our human service centers and social service staff who are meeting on the front line of addressing this economic impact of the virus and its spread throughout our state. Based on the strong foundation of the good working relationships from this past legislative session, us four legislative leaders, along with the Governor's office, have continued with collegiality in advocating for how to respond to this public health crisis, including how best to invest the CARES Act funding. I have not been shy about the fact that while I've agreed with the investments made to support working families and small businesses, there's more we need to do, as has been proposed by legislators. But we also need to engage the entire legislative body more often when allocating this level of funding. It is my hope, and I believe the hope of the other leaders, that Congress will grant an extension beyond December 31st of this year to spend down the CARES Act funding. This not only allows for greater deliberation of how to invest the remaining funds, but also allows for them to be intentionally allocated rather than being forced to be spent down. When Congress allocated these funds, it was based on the belief that as a nation we would have this virus under better control by the end of the year, and unfortunately that's not the reality we're facing right now. There's a lot of work that us as individual North Dakotans and Americans have to do, as well as every level of government, to get this virus better under control. As I said at the beginning of my remarks, us four legislative leaders have been working well together, and I hope that as we plan for this next legislative session, that continues, as there's going to be a lot of tough decisions made as we adjust rules and try to prepare to make sure that the session is safe not only for us as legislators, but also our legislative staff and for the public to participate. With that in mind, I'm asking our friends, family, and neighbors throughout this great state to please heed the guidance of medical professionals in wearing a mask when in public. Do not attend large gatherings, wash your hands, and if you are around other people, to be physically distanced from one another. I wear my mask not only for all of you, but primarily for my mom and my grandmother. My mom is a nurse at a hospital that, like most hospitals in our state, is facing a shortage of healthcare professionals. I don't think there is a North Dakotan out there who doesn't have a family member or someone close to them in the medical profession. The more of their staff that get sick or have to quarantine, the more burden it puts on our system of dedicated nurses, physicians, techs, and support staff, who, like educators and parents, are sharing increasingly number of stories of burnout. We have to follow these guidelines for one another. The holidays are right around the corner. Thanksgiving is 7 weeks away, and I, like most of my fellow North Dakotans, would like nothing greater than to be able to enjoy that long weekend with my grandma. She's a resident of a nursing home, and at the rate that the virus continues to spread throughout our state, I'm fearful that for many of our families, we may not be able to spend the holidays with our loved ones. So it's incumbent on each and every one of us to do what we can to take this virus seriously. As it's been said, wear a mask in public, do not attend large gatherings, wash your hands, and practice physical distancing. Let's do it for our families, let's do it for our educators and our students, and let's do it for our healthcare professionals. Thank you, Governor.
Good morning, ladies and gentlemen. And as I am the guy who's finishing up. So what Senator Wardner, Senator Heckman, and Representative Boucher talked about, I will try not to repeat that. But what I'd like to talk about just real quickly is what the legislature went through with the executive branch when we were dealing with the CARES dollars. And so what happened as soon as this money was allocated to the state of the $1.25 billion, right away we had the executive branch's staff call the leaders. We were having weekly, daily conference calls with what was going on in our hometowns because we are a citizen legislature. And so we had those daily calls, and then those daily calls would branch out to other legislators as well. And so what was happening during the whole thing, if we had a Bank of North Dakota or an economic development issue, certain legislators who were involved in that in their committees were called upon to give an idea. An example is child care as well. We had the policy committee chairman of the House and the Senate, as well as vice chairman, as well as appropriators, talking to the directors of those agencies. There was an open dialogue, I feel, all along that was always available. And I know as well that I talked to the governor's staff, and at times they would spend hours on the phone talking to legislators with what their concerns was. And it didn't matter if it was higher education, K through 12 education, unemployment with the trust fund, whether it was human services. Always there was certain people in the legislature that were contacted. So there was always an open dialogue between the executive branch and the legislators. Now, did the legislators and the executive branch always get along? Of course not. But we come across with agreements, and that's the way the process is supposed to work. I'm not going to say much else except I know I'm one of those that When I'm from the small town of Carrington, but I'll guarantee you if I'm going to the local hardware or the grocery store, I'm going to take a look and see how many folks are in there. If I go in there, I'm going to wear a mask. If it's really crowded, I'm probably just going to avoid it and go there at another time. So I think it's important for citizens of the state to practice personal responsibility, practice social distancing, and the whole bit. I also believe too as well, I won't say believe, my heart goes out to all the families that have had to go through this, and I'll speak on just from a House caucus perspective alone. We lost a House candidate running for election this week, and my heart goes out to his family, and so I think it behooves all of us to practice all personal responsibility, especially, and I want to thank the leaders of the House and the Senate, because there's been a lot of phone calls, and I do want to thank the executive branch and the governor as well, because our dialogue is open. It's not always pleasant, but it's open, and that's the important part of the process, and it's an important part for the citizens of North Dakota. So we try to get the funds, whether it's K through 12 or whatever it is, so that we're making it work as best as we can. And the legislative session will be a challenge, but I look forward to the open dialogue. I want us to be here in Bismarck, whether it's a hybrid method or what we need to do, but we need to make sure that the process is going to happen. So with that, I want to thank the opportunity to be here, Governor, and thank you.
Thank you, Chet, Josh, Joan, and Rich, for speaking today. Thanks for your collaboration. Thanks for your input. Thanks for your leadership. And for the press that's here online, Rich had another meeting he had to head out to, but the other three leaders will be available for questions at the conclusion of today's presentation. Our next topic is hospitalization. And this is a chart you're familiar with. We show it every week. This information's always been available online, and it is COVID-19 patients that are currently hospitalized due to COVID. Of these 125 patients, 27 of them are in the ICU. And from the beginning, like with the legislature, before we even had our first hospitalized case in North Dakota, we had convened meetings with the hospital leaders across the state of North Dakota, and we're fortunate that we've got an organization here, the North Dakota Hospital Association, 46 members, includes over 50 medical facilities, and right now they're managing those facilities, excluding the VA and psych and rehab hospitals, but of our traditional medical hospitals, they're managing about a total of 1,840 staffed beds. And staffed beds, of course, can go up and down. They can fluctuate from day to day. They can even fluctuate from hour to hour, shift to shift, based on patient load, staffing levels, variations in hospital business models, given current conditions. As you can imagine, given the challenges in that we've had in healthcare, even pre-pandemic. No hospital, whether you're a for-profit or nonprofit, would have a bunch of staffed empty beds, because that wouldn't be good for your business model. And so we do see staffed beds go up and down. We have updated our dashboard at healthnd.gov to display how many staffed beds we have statewide and the percentage of those beds that are currently available. If you go out there right now, you'll see that 15% of the staffed beds in North Dakota are available right now. We're going to be working on updating this to statewide. We're also going to be looking at this at sort of our major metro hospitals as well, to see if we can get even more granularity across those. We have also added some new data that's on here, which is in addition to, we've always been reporting people hospitalized due to COVID, but as we've dug in recent weeks with our hospital leaders, they've got another category which they're going to be start reporting, And that category is going to be people who are hospitalized not due to COVID, but who are hospitalized with COVID. There are many examples of how this might occur. Say somebody comes in for a knee replacement. They're coming in for a knee replacement, and as part of that procedure, they get tested to protect the workers, and they find out that that person at that time has COVID. But that's not the reason they were coming in to the hospital. If you had a student athlete with a sports injury and they came in, they may be tested and they may turn out that, again, they've got no symptoms, they're asymptomatic, but they test and they're positive. If they were to be hospitalized, then that would be someone who's hospitalized with COVID but not due to COVID, so they're not being treated for the COVID. The number, we currently have got the number of the combined total of people with and due, but due to is the ones that are using beds because of the COVID diagnosis and COVID treatment, which we've have been reporting with this new numbers on there is 196, which again represents a small fraction of the over 1,800 beds that we have available in the state. Thankfully, and we should make sure everybody knows this, the state of North Dakota does not run hospitals in our state. The federal government runs one, that's the VA, but we've got a great network of both nonprofit and for-profit hospitals. We're working with them in collaboration. They work in collaboration with each other, both within the system, sometimes in system. They make decisions like transferring patients from one of their facilities to another to make sure they receive the best care. This happens even pre-pandemic, but there are in-system transfers. We've also got out-of-system transfers where our small critical access care hospitals have always had relationships with the larger regional metro hospitals in terms of transferring patients. And so that has always been part of the network and safety net of care we have in our state. That continues we have during COVID. But here to talk more about hospital capacity statewide and specifically about the Bismarck region is Dr. Michael LeBeau. He's been on the stage before with us here, been at the podium before. He's the president of the Bismarck region of Sanford Health, and again, speaking on behalf of the NDHA. Then there are 46 members and there are over 50 facilities. Dr. LeBeau's been a fantastic partner, working closely with our office, with the Department of Health and Department of Human Services. Want to thank him for the work he's doing every day, and all of the people within the North Dakota Hospital Association doing great work to serve the citizens of North Dakota. Thank you for being here, Dr. LeBeau.
Thank you, Governor. Thanks a lot for having me. Seems like a lot has changed since last time I was at the podium. It's been a long 6 months. I think it's important as we get started today to acknowledge our high capacities. We hear the stories, we hear people's talks, we hear the media requests, and we are at high capacity across our state. I think one of the things we're lucky for is the health of our healthcare system in North Dakota. These have been tough times, and as I stand up today, I'm proud to be part of the healthcare solutions of our state. And I would be remiss not to send out my sincere gratitude to our frontline staff. And I think it's important that each of us to really understand healthcare heroes. I was speaking to our group just this week, and I had come from a meeting where people still weren't face-to-face, and maybe rightfully so. To safeguard each other, to safeguard they're working from home, not face-to-face. Healthcare workers never got that luxury. They've stood in harm's way since day one, and I think as a state, we've held together very well. This is a significant challenge for healthcare. For anybody not to say that fooling themselves or at least trying to fool you, this has been a big challenge. But we've had 6 months to prepare. And this really is healthcare's calling. As we stand up, we're proud to be on the front lines. That healthcare burnout is equaled with healthcare pride. Our frontline staff are getting through this pandemic. They're supporting each other. We're doing what we can to support them. And I think that's an important part for everybody to remember. I feel very comfortable standing up speaking for North Dakota hospitals. One of the great byproducts of this pandemic has been teamwork. We had a long conversation yesterday with hospitals across the state, and I can assure you that although competitors, we feel very linked and very much a team as we serve our state. Healthcare is going to look different. It has to. These are different times, and we have to be okay with that. The stories I hear that I find interesting are somebody waited in our emergency department for 3 hours. That speaks to how fortunate we are to be living in this state. We've come to expect excellent health care, and I believe that. Despite being a rural state, despite being challenged by potential obstacles, we've always figured it out. We work together well pre-pandemic, and I think we work together now. We're going to have to live with longer waiting times. If there's more people being seen, longer waiting times become the norm. Rest assured that we triage patients, that each patient is dealt with directly and independent of everything else going on. And so as each patient encounter across our state is handled, it's handled for what's best and most safe for that patient, not for capacity, not for what's going on anywhere else, but in the face of that patient. Triage plans look different than they did pre-COVID, and they're gonna look different. You may wait longer in an emergency department. You may have a hallway bed. You might be in a waiting area to be admitted into a hospital, or you may be transferred to another facility. I'd like to take the opportunity to talk about rural health care. I'm from a small town. I'm from Newtown. And we've always felt supported by regional hospitals. I'll tell you, regional hospitals feel supported by critical access hospitals. It's really a neat thing. In today's world, we can reach out to them, help with triage plans. Some of our less critical folks can finish their hospital care close to home. That should be okay. We should be proud of that as a state. We don't have to apologize for that. If you can get care close to home, shouldn't that be our goal? Why should you have to be 200 miles from home to get health care? And so we're going to emerge from this a better health care delivery system. And it's going to start in our rural hospitals. And a special shout out to many of our hospitals that are stepping up and delivering more care at home. There's nothing more scary than to be sick and not have anywhere to go. And we're rapidly developing more care close to home. And this is really going to allow us to deliver care more effectively going forward. There's going to be some bumps in the road, and we ran into them, but we address them every day as we meet. And we feel that we're prepared, and we feel comfortable where we're at. I also really want to take the opportunity to thank the state. Number 3 today in testing. Don't lose sight of that. The more tests you have, the more positives you'll find. That's our goal. We got to remember that's our goal as we treat COVID, is to find the positive cases and intervene appropriately. It's really easy, and I'll tell you, just myself personally, I've had many times where I thought, boy, it'd be easier if we didn't test as much. Then I wouldn't know. But that's not the appropriate treatment. And so we have to be okay with knowing how many positives we have. And if you look at our positivity rate, it's 20% today, or 20th in the country, excuse me, today. So although a problem, we are identifying our cases. We're being proactive, and that really, I think, leads, from state leadership. I also want to take a chance to thank our Department of Health. We take them for granted every day. our health officers, the work they do on the front lines to keep us safe, to keep us healthy. It's been a tough time for them. They've been under fire every day since March. Our health officers are under fire. They're doing their job for us. It's not always popular. We don't want to hear the bad news. We don't want to hear the difficult things we're up against, but we need to. We need to, as a society, to take care of ourselves. And so, as I think about from a hospital perspective, I can stand up here and feel comfortable looking anybody in the eye and say, we are prepared. Although different looking, many triage plans, some transfers, and many more inconveniences for each of you as you deal with us directly, know that our healthcare system feels very comfortable and we feel very prepared. I think it's important. The last thing I'd just like to talk about is non-COVID. I think it's important for us as a state to remember that there's a lot more health conditions than just COVID. About 10% of our hospitalizations are COVID related today. We're going to break it down with COVID or due to COVID, but either way, it's less than 20% of our hospital is due to COVID. What we're dealing with today is still a backlog from deferral of health care for 2 months. During COVID times, breast cancer detection rates were about 20 to 25%. Rest assured that breast cancer doesn't go away because of COVID. And it's our responsibility as healthcare providers to catch everything as early as possible and to deal with wellness. Vaccination rates have dipped dramatically. There's long-term consequences of that. So what we're seeing in high capacity has to do with all of our healthcare. And so it's important to know that we're in the forefront of finding it, that it's difficult times, but we're going to strongly encourage people, keep coming in for health care. Take care of yourself. Last thing in that is wellness. I heard burnout mentioned multiple times today. It doesn't matter what profession. Healthcare is not alone in burnout. I hear COVID burnout. I hear education burnout. It's time to take care of ourselves. It's time to take care of each other. And I feel lucky to be a North Dakotan. As I stand up here, we're a strong state. People take us for granted for what we do day to day, and it's our teamwork, I think, that separates. And so my encouragement is obviously the same as everybody else. Let's keep working on our personal responsibility and our accountabilities. Each time I go out, I see more masks. There's nobody in healthcare who would look at you and say anything but please wear masks for yourself as well as your grandparents. We had our first teenager pass away from COVID. That's heartbreaking. I got a chance to visit with the hospital staff. That's a devastating event. That's devastating for a family. I think it's important for us to remember all of the things that we can do to care for each other and to care for ourselves. I want to say thanks for the opportunity, Governor. From North Dakota Hospital Association, like I said, we feel comfortable, we're ready to persevere through this, and we know we have a long road ahead of us. So, thank you.
Thank you, Dr. LeBeau, and thanks to the North Dakota Hospital Association. Thanks for being here. Dr. LeBeau will be available for questions, but we appreciate your leadership, your care, and all the people that work for you and work for all the North Dakota Hospital Association members that are on the front lines. We're going to take a look next at some movement in the county risk levels. As you know, we've got a 5-point scale going critical. Red, high, is orange, moderate, is yellow, low, green, and what is sort of the better normal, the new normal, is the blue. And we're going to just zip through some of those. And I know Lindsay's asked me to speak a little slower when I'm flying through the counties, but this first chart should be easy because we only have one county, which is Ransom, which is going from the low level or green down to the new normal. So congratulations to Ransom County. And then the southeast part of the state. Our next slide, also pretty easy, which is we've got two counties that were at the moderate level, the yellow level, that are dropping down to green. And I want to pause here for a point of inspiration, because we do hope that we can have, in the weeks and months ahead, be celebrating a lot of this kind of movement. Stutzman, of course, home to Jamestown, home to the University of Jamestown, Richland, home to Wahpeton, and a lot of great Class B communities. But Wahpeton, home to North Dakota State College of Science. I want to, again, mention this because we've got two counties with medium-sized metro areas with universities that are moving the right direction. This is because we've got local leadership, we've got students wearing masks, we've got people avoiding large gatherings, things are happening. So this is that we're at the lowest levels, meaning new normal, that we're blue, that are moving up to green because they've seen some increases in activity in terms of cases in their counties, and that's Pembina, Rolette, Nelson, Walsh, Trail, McIntosh, and Lemoore. And next, we've got 10 counties that are moving from green to yellow, which is these are folks that were at the low risk level that are moving to the moderate risk level. So again, if you're on this group, again, pay attention, because this means Logan, Sioux, Grant, Golden Valley, Montreal, McHenry, Ramsey, Eddy, and Bottineau are on that list. We have a number of counties that are staying where they are. I won't read all of these, but 11 counties are remaining at yellow, 14 are remaining at green, and 5 are remaining at blue. But as we talk about, how we want to lower our possibility of transmission, I mean, one thing we look closely at is positivity rates. We talked earlier about the statewide 7% approximately rate on the rolling 2-week average. But let me give you, some of these counties have had a few cases with low testing numbers, but again, we're just going to go with the positivity rate. But Golden Valley, 24.5, Emmons County, 23.8, Slope County, 22.2, Grant, 17.7, Dickey, 16.7, McHenry, 16%, Montreal, just under 14%, Williams, 13.6, Dunn, 13.4, Kidder, 13.1, Nelson, 12.2, Stark, 11.8, McKenzie, 11.4, Logan, 10.1, Oliver, 10.1, and Bottineau, 10.0. And again, I list these because these are the 16 counties that have positivity rates over 10%. And so I would, again, say that within these areas, this is where we need leadership. And a couple of the great examples coming out of Stark and then also Williams County, Williams being home to Williston, and Stark being home to Dickinson. But I want to thank Mayor Klug from Williston, who took decisive action in the past weeks, canceling special event permits, canceling alcohol permits until the county's numbers drop. Mayor Decker in Dickinson also delivering some strong leadership on regulating group gathering activities. That is, again, much needed and much appreciated to do that. I want to just say again, when we take a look at next week, when we come back during the following week, we're going to be reviewing all the guidelines that go along with the color levels, because again, we continue to learn things. One of the things we know, we were very concerned, say last spring, about personal care businesses. Now we've got evidence that if both people are masked properly in a personal care business, then the risk of transmission may be low. And so part of our guidelines, if you got to the higher levels of risk, then the guidelines were suggesting that local entities should think about closing those businesses. is if we've got new information and new data that tells us that that may not be where risks are, we want to do some adjustments. So there may be some things coming where we would be less restrictive on some activities if we've got appropriate masking, but we also believe that one of the ways where we are seeing spread is with large group gatherings, and so we want to again stress this. I talked a little bit about this last week about there has been discussion about the R naught or the R little teeny zero, which is the rate of spread. And of course, if the rate of spread is higher than 1, then it means that every individual who's a positive case gives it to more than one other person, then our numbers continue to grow. If every person who has it gives it to less than 1, our numbers would drop. If every person who has it gave it to no one, our numbers would drop rapidly in a matter of weeks as the recoveries occurred. We would, if everyone gave it to no one. But it turns out the R naught, like a lot of other numbers in COVID math, is an average. And it appears now, again, through better understanding of the spread, that say 5 people that may be test positive, 3 of those may isolate perfectly and not give it to anyone. So there's zero, they have zero transmission. They're, 1 case, 0 transmission. Then you might have one person who, tries to do their best, but for whatever reason, they end up giving it to one other person, maybe somebody else in the household. And then you'd still be well below R naught of 1 because you'd have 3 people giving it to none and 1 person giving it to one other person. But if the 5th person in that group says, hey, I'm not feeling well, I've got the sniffles, I got a cough, but I really don't want to miss this wedding, or it's really important for me to go to this funeral, and then you go out, then that person may actually give it to 5 or 10 people. And so again, avoiding large group gatherings, restricting size of gatherings at the local level, churches and other organizations where you've got regular gatherings, where you have opportunities for social distancing and mask wearing, at high school athletic events, we know are showing up on contact tracing, whether it's volleyball, which is indoors, or football outdoors. People in close contact, not masking and cheering and yelling are transmitting. And so again, these are events we know you may not want to miss, but if you can go and stay apart from other people and wear a mask, then you can be part of the solution, because you're not going to either be a transmitter or a receiver. You're not going to give this virus a place to live. And again, so that's one of the increasing focuses that we want to use as a strategy, where we can keep the economy open, keep our schools open, keep our students and student athletes doing what they love to do, but we as adults can make sure that we're taking the steps to help reduce the spread through these spreading events. Okay, so stay tuned for that next week. And if you're a county who has seen your color change, all of the guidelines are out there under North Dakota Smart Restart that are still in effect, and those are guidelines, not mandates, but it's a good place to look to for how you might slow the spread in your county. And then also those guidelines go into effect tomorrow. The defend cybersecurity is the next topic. And as we know, one of the things, again, lots of other things going on during COVID, not just people individually trying to do cybercrime in terms of attacking individuals with scams, but we also know that it's been on the rise globally, and it's on the rise globally by state-sponsored actors. And with our increasing, interconnected nature of our world and how we work, the shift to remote work and e-learning, there's more physical endpoints or touch points, the surface area of attack, if you will, because there's more devices hooked to our state networks than ever before. It gives an opportunity for individuals, criminals, to try to exploit people for personal gain, or for countries to try to compete with and attack the United States. Make no mistake that cybercrime is not a little thing, and it's not just something that might show up in a movie. It is now a multi-billion-dollar illicit enterprise. Educating North Dakotans on this growing threat of cyber attacks is a priority for the state of North Dakota, and part of the mission of the North Dakota Information Technology, or NDIT. That's why we've declared October Cybersecurity Awareness Month in conjunction with the the National Cybersecurity Awareness Month to help raise awareness on the prevalence of cybersecurity threats and to help protect and defend all North Dakota citizens in their online activities. This year's theme is Do Your Part, Be Cyber Smart. It's also the center of North Dakota Information Technology's new statewide cyber outreach campaign, which is called Defend, with the last two letters capitalized. And so, of course, the last two letters of Defend are ND, so Defend ND. This campaign, which is going to run on TV and digital channels through the fall, is designed to help North Dakotans understand common threats, which include phishing, and not the kind of great fishing we have in North Dakota in our lakes, but the pH kind of phishing, vulnerabilities associated with weak or reused passwords, dangers of sharing information online. Information is going to be included on the new defend.nd.gov website. Includes steps where you can learn to defend yourself and families from cyber attacks. This continuation of threats and trends have been posted on ndresponse.gov website since the beginning. We've been aware of this as a problem where we had over a 5-fold increase in attacks against the state of North Dakota. But if everyone does their part, and that is every teacher, every student, because we've got the surface area in North Dakota with our StageNet email system where all students and all students at the K-12 and higher education and faculty are all tied to the same network, over 250,000 people using the same network. We have the surface area of a Fortune 50 company. We are a really it really would be a really valuable attack for a foreign country to come after North Dakota because of our position in energy production, and military defense. So we need to defend not just our state, but our nation with the work that we're doing here. For more information on online security, again, please visit defend.nd.gov. Our behavioral health update is also slides into our good news category here, which is the North Dakota Department of Human Services Behavioral Health Division, which has been working, round the clock like all of our health-facing departments have been since the pandemic began. They've just been awarded a $4 million grant from the Substance Abuse and Mental Health Services Administration, known to those in the industry as SAMHSA. To support the state's behavioral health response, not to COVID, but to the 2019 federally declared flood disasters. As you might remember, we had lots of spring and fall flooding in 2019 that affected billions of dollars of agricultural crops and families and communities across our state, and it's been financially and emotionally challenged for many North Dakotans that were directly and massively impacted by the floods and then the pandemic. But this grant coming from SAMHSA provides an opportunity to increase vital behavioral health services, including mental illness and very importantly addiction treatment services, crisis counseling, and other related behavioral health services, and supports those living in the areas directly impacted by the declared disasters, and many of them had been impacted by both COVID-19 and previous natural disasters. This 2020 disaster response grant program covers individuals impacted by the 2019 floods in the following counties: McKinsey, Montreal, Adams, Hettinger, Grant, Morton, Emmons, McIntosh, Dickey, Sargent, Richland, Ransom, Lemoore, Logan, Kidder, Stutzman, Barnes, Cass, Trail, Steele, Griggs, Foster, Eddy, Wells, Sheraton, Nelson, Grand Forks, Welsh, and Pembina. And a final reminder that whether you're in one of these counties or anywhere in our state, that there's free and confidential crisis counseling currently available to all North Dakotans. We talked here today, you heard from other speakers talking about COVID-19 burnout among teachers or frontline healthcare workers, or even if you're just a parent dealing with all of this. Projectrenew.nd.gov, projectrenew.nd.gov, or call 701-223-1510 for free and confidential crisis counseling. Another piece of good news is that The North Dakota University System, which is our statewide network of 11 universities, held the hashtag COVID Challenge Campus Video Contest, inviting students to produce and submit videos promoting COVID responsibility in our communities. The first round of competition led to 3 finalists. They were representing one of our 2-year institutions, one of our 4-year institutions, and one of our research institutions. The 3 finalist videos came from Bismarck State College, Dickinson State University, and the University of North Dakota. All the teams submitted great videos highlighting simple and effective ways to protect each other. And I want to thank all the student teams who submitted a video and all the students who are practicing good COVID etiquette. But a big congratulations goes to the statewide winning student team of Parker Stenseth, Easton Hoffman, and Paige Shore from the University of North Dakota for their video, Pandemic Police. You submitted a great, fun video, and we agree from the conclusion on your video, it is all of our jobs to promote public health. On our gratitude section for this week, some of you may have noticed that last Sunday, flags were at half-mast across the state. We did this as part of a national and state effort to recognize the fallen firefighters Memorial Weekend, which is this last week, but also to celebrate this week, we're celebrating Fire Prevention Week, but the flags were at half-staff for those fallen firefighters who'd given their lives to help protect and save us. We want to share our gratitude across the state with the brave men and women, both our career fire departments and our many great rural volunteer fire departments who serve our communities with great dedication in good times, bad times, and pandemic times. So again, thank you to all those people who don the firefighting uniform. We also want to thank and give a special shout out who've just safely returned. We had 17 firefighters from North Dakota who hailed from Minot, Williston, Grand Forks, and Fargo who had volunteered, but were part of a team that was deployed for 2 weeks supporting the wildfire response in Western Oregon. Thank you for your service to other states, and thank you for all you do to keep our communities and citizens safe. In closing, with our gratitude quote for the day, 53-year-old Professor Shania Lumersky said that gratitude is an antidote to negative emotions. Gratitude is a neutralizer of envy, hostility, worry, and irritation. It is savoring. Gratitude is not taking things for granted. It is present-oriented. So with that, I want to say again, grateful to having the legislative leaders, the partnership that we've had through all of them here, and we've got 3 of the 4 here for questions, as is Mike LeBeau, as is Chris Jones if needed. But with that, we'll stand for questions. Jeremy?
Governor, I wanted to ask you about risk levels. Emmons County, Dickey County, Golden Valley County, Grant County, McHenry County all meet the active case and positivity rate criteria of a critical risk county. There are 9 more counties that are meeting those 2 same criteria for the high risk level. Why aren't those counties moving up today?
Well, the same question, same answer to the same question which we've answered before, which is we take a look at things holistically, not just numerically when we're making these decisions. Some of the ones that you mentioned have got high positivity, but they've got a low number of cases, and we know that that can throw off the data. So we take a special look to make sure we're not creating a negative effect when there might have been, it could be as simple as a single family or a single event that might throw a county like that off if you've got 20 or less cases in a county. But I think what I highlighted in my remarks today is that we want to take a look at all of the criteria that go along with the changing of the risk levels, because even though they're not mandates, we want to make sure that we're sending the right guidance out to the state. And if we move people up a level and that keeps, under our current guidelines, North Dakota Smart Reset, it might move up a level, then someone might say, oh, we should close a personal care business, but it's still okay to have a 250-person event. But now we know things we didn't know this last year, which is personal care with masking probably could stay open. even at lower risk levels, 250 people in an event, particularly if someone is showing up. I mean, we've had contact tracers report when we're doing the work is, do you think you know where you got it? Well, yeah, I was sitting next to someone, at a pew at a wedding, and the person was coughing. I mean, it's like, even before the pandemic, if you're not feeling well, you should stay home. Even during flu season, stay home. If you're symptomatic and you're coughing and you're sneezing, I mean, again, that's a simple thing to ask here, but if you're coughing or sneezing or have the symptoms of COVID, you should, A, get tested, and B, you should isolate until you get your test results back. I mean, that thing alone could save us. You want to preserve hospital capacity, not feeling well, have symptoms, don't go to large events. So we want to make sure that we're providing guidance that matches a common sense approach with the least amount of restriction on businesses and the most amount of impact on reducing transmissible moments. And that's why I've asked the team to completely relook at the guidelines. And until such time, we're going to, would hold off on moving people to another level. But we would say that anybody's at that moderate risk level, like we saw from the mayors in Dickinson and in Williston, there's plenty of action that can be taken. Any community that wants to go beyond the guideline recommendations, any community that's seeing rising cases, any community that's got more than 10% positivity rate, if they don't have a task force, they should create one. They should get together. They should be talking to their local health officials. They should be talking to their local hospitals, and they should get together and say, what are we going to do about this thing? What can we do? Get the schools, schools could say, if schools are going to say all students must wear masks in school, schools could also say everybody's got to wear a mask. All adults have to wear a mask if they're coming to an athletic event. Those are local decisions that could be made. But they don't need to be, as we saw, we've got other counties that are moving the way. Some of these things don't need to be applied statewide, but local leadership means making tough decisions based on the data in your city or your county, and those are available to people.
There, why have these three main criteria, positivity rate, active cases, and testing, if they're not being acted on?
Well, I think they are being acted on because we saw that plus all of the criteria that we had before. I think there was 11 other items that we've looked at. We saw close to 20 counties move today, so we are being acted on it. But we're not going to move. We're applying judgment to the framework so that we again take action that reduces the most. We reduce the most number of transmissible moments with the least amount of negative impact on people that probably aren't really involved in transmission. So again, it's going to take some modification. Amy and then Jacob.
There was some news yesterday out of Wisconsin that the state was setting up a field hospital due to high hospital capacity. Are we at all getting to that point in North Dakota? Has there been any talk about doing that again?
I would maybe ask Dr. LeBeau to come up and talk about, because I know they've been working, and with Chris Jones, we've been talking about make sure that if it ever were needed, we'd have surge capacity. But I think what you're talking about was in Milwaukee. I'd heard that as well. But we are a long ways away from that here in North Dakota. And I think we've got a lot of other options before us before we would get to that. But I'll let Dr. LeBeau answer.
I think that really is a good question, and it's one we've probably been getting the most often. I think when we talk about field hospitals, I think we should be talking about delivery of care. So one of the things we're working on currently is an updated surge plan. I think hospitals across the state are working with the state, working through North Dakota Hospital Association to make sure that we have a surge plan. We feel that we have capacity in the state today, and we feel that we have the ability to flex beds as needed. We also believe as healthcare that we're going to be better served with healthcare under our roof. And so I think it's important, for people to understand that, a field hospital is really at a time of severe crisis. We should be able to manage the crisis that we have right now, and we feel real comfortable that we have plenty of capacity to flex beds as needed if and when numbers go up.
Sure. And when you say flex beds, what do you mean by that?
So if we think of flexing beds, we think of it as surge planning. When we say healthcare may look different, we may deliver care differently in our hospitals. we may have to expand areas that don't have hospital beds today that can. And we think that we can increase the numbers dramatically if needed. And like I said, we feel very strongly that the best care of patients is under the roof of a hospital.
For you if you have some time. No one is going to deny the difficult position many healthcare facilities are in and the stress that's been put on the system and the difficult decisions that need to be made at all angles. But during your speech today, you said that your facility was focusing on what's best for the patient, not necessarily what's best for capacity. But at the same time, you guys have had a policy for a few weeks now where if one of your nurses or doctors is a close contact, they are called into work even if they haven't been tested. So how do you balance that policy with that mindset?
Yeah, so question on testing. I think it's important for us to understand that, we follow CDC guidelines. And so if you look at the current CDC guidelines, it states that essential workers, if asymptomatic, return with masks. I think it's important for us to understand what an essential worker is. And I think it's important that we still do everything possible as far as testing. Any symptoms changes the CDC guidelines, but just as far as from a CDC guideline perspective, it's a conversation we've had amongst, state leaders across the hospitals. And so I think it's a fair question, but it's one that, as you look at it, it really is, from CDC guidance that we're following.
Go ahead.
Okay. I have a couple questions for you, I guess. If there's more of a strain on capacity, would you consider suspending elective surgeries or taking sort of a step that hasn't been taken so far in the pandemic?
Good question. So as far as elective surgeries, I think it really goes back to managing healthcare. I think we're at a unique time and kind of a spot where we're kind of pivoting. A large amount of our capacity comes from non-COVID, a large amount. We believe that large amount is from deferral of health care that we had in the spring and early summer. In fact, it probably lasted for some people throughout summer. However, I think it's important as we look at hospitals that we work on bed management. And so it really is finding the balance of each surgical intervention has to be decided by the surgeon and the patient. Most of our elective surgeries don't require any hospital access. They come in, they get an elective surgery, and they go home. And so it doesn't affect our hospital numbers. And I just think it's something we have to take day by day, and we look, it really is kind of how you operate, with or without COVID, it's how a hospital would operate.
I just have one more for you. There's been some speculation, obviously we haven't gotten to this point yet, but when the winter hits and flu becomes more of a problem, that will overwhelm hospitals to an even greater extent. I'm wondering if you can speak to that and whether you see that as being an issue.
We owe you for that question, Jeremy. That's a good question, and it's something I probably left out of my speech. I think it's really important when we think about influenza season, it's no different as far as our own personal responsibility. Every hospital across our region is pushing hard for influenza vaccinations. It's actually a preventable disease. And so when we talk about responsibility, you'll see drive-up vaccination drives, you'll see. We are optimistic. The vaccination looks good this year, at least in the southern hemisphere. In southern hemisphere, influenza admissions were down. And as we treat influenza, one of the things we're learning as a society that social distancing, masks, and frequent hand washing will decrease those numbers. And so it is a potential risk, but it's a preventable risk, and it's something that we are really out trying to counsel folks on. Thank you.
One quick question for you. You had mentioned that, transferring patients is one way that hospitals are, dealing with high capacity right now. Can you speak to that from Sanford's perspective in terms of, how many patients is Sanford having to send elsewhere, and how far are they having to be sent, or any having to go out of state?
So from a transfer perspective, I don't know that I can speak to set numbers. I can speak to our set philosophy. We feel very comfortable in a couple of philosophies. One, from a COVID perspective, we think that COVID should be treated in a cohorted unit. It should be isolated and treated separately from the general population, and I think we feel that across the state. If you look at just hospital capacity, we have to maximize the cohorted units that we use. It gives us the most efficiency, and it allows us to care for the most number of COVID and non-COVID patients at the same time. As far as transfer, we do transfer people out of the state. Our goal as a healthcare system is to eliminate that. It's to grow our own super subspecialists to take care of folks. So those numbers will vary day to day. People that need transplant services outside of kidney leave our state today. Some of our severe traumas, there's a few things that will leave just traditionally, whether it's to the quaternary services in Minnesota. And so those numbers haven't changed. If you look about how we manage capacity, that has changed recently. And that becomes really the teamwork that we have to do across the state. An example I would use would be somebody that would be admitted to Bismarck that might finish their care in Hettinger. They're from Western North Dakota. That's new. That hasn't been done before, and I think it should be. It's care close to home. We believe that that's better patient care. And we believe in our rural hospitals, and as long as we have an ongoing communication and relationship, we feel comfortable that that's safe for patients. As far as distance, we do transfer from Bismarck to Fargo, and we have for a long time. It might be a service we don't have. It might be that our cohorted unit currently is full, and we have capacity in a cohorted unit in Fargo. And in order to open up another cohorted unit, we might lose significant capacity. And so it's kind of a patient-by-patient treatment plan that's developed.
Are there any COVID patients that Sanford has had to send to hospitals in other states, just because of capacity issues?
So as far as leaving the state, not to my knowledge, but I can't speak for all of the hospitals. I do think that there might have been somebody that left maybe within the last week that left the state, but our general philosophy is no, and I can tell you that currently we're bringing in extra beds, equipment, and staff to increase the COVID numbers. I'm going to bring Chris up here maybe to answer that for you a little bit further.
And thank you. Just to reiterate, there are a lot of anecdotal stories out there, and the hospitals are making their best determination. It was actually closer for the patient and their family to leave the state. So it was a patient in North Dakota who went to a hospital in South Dakota. And so sometimes people, the natural transfer plan is to go to Bismarck. This was in the best interest of the patient. So we just ask we look at things that way as well, and not just the state or man-made boundaries. Thank you.
Renee Jean with the Williston Herald. What are we, and I think you might have touched on this a bit, but what are we doing in hospital facilities to keep patients who don't have COVID from catching COVID while at the hospital?
So what do we do to prevent, we call them nosocomial or hospital-acquired infections? We would think of COVID in that same light. When we get to these conditions, we have negative pressure rooms, meaning that it has its own air supply. And so once you're in that room, we're protecting the general population of the hospital from that air. We believe in cohorted units. We believe in keeping them separated. We think there's efficiency in that. But then it's just the general maintenance of our hospitals. It's the personal responsibility that we're held to every day. Washing our hands in between patients, the importance of always being masked, using our PPE appropriately. And it's one that I think every hospital is working at every day, and we have been for a long time.
One more. Dave Kolpak with the Associated Press in Fargo. Do you agree that a statewide mask mandate would not be helpful in North Dakota?
Mask mandate. When I get asked about mask mandates, I really think that that comes from our government officials, the mandates. I can speak to the importance of personal responsibility in each of our roles. And so when people ask me about mask mandates, and this goes back to pride of North Dakota, I believe that we do the right thing as a population day in and day out better than most places. And so I think our personal responsibility and the importance of wearing masks is undeniable. But, you know, from a mask mandate, I don't know that I would speak to that.
Thank you, Mike and Chris. As a reminder, we have three of our legislative leaders here, and I can tell they're all itching to get back at the podium. So if anybody has questions for them, I'm happy to take that. But I'm going to go to this side. Lane, question?
Yeah, Governor, some of our rural counties have been seeing increased numbers. Emmons County specifically has seen quite a few. Do we have any idea of why that is, if it's large gatherings or just not complying to some of the guidelines?
As best we can tell in some of our rural counties, it really comes down to the things I've already mentioned, which is we've got church, we've got weddings and funerals, which may be different than Sunday or weekend services, and then high school sports. And I say high school sports because most college sports in our state are not happening, but high school sports are one places in rural areas where there are large congregations of people with reports of limited mask wearing, with people shouting, cheering, doing all this. And we do know that from some of the earliest studies, including the one from the state of Washington where nearly 60 people got sick after a church choir practice, we do know that the activity of shouting, singing, and loud noises like you can have in a bar sometimes, where you've got people that are in close contact with loud noises, then people have to talk louder to be heard. They're potentially emitting more virus in those scenarios. So again, I think things to look for people is just to make choices. You heard it from some of our legislative leaders. You've heard it from the medical community, which is if there is a large event, you can choose to not go to it. Many of that stuff is available even in the rural areas right now with great local cable TV. You can watch high school sports online. Local school districts to try to keep their teams on the field and their students safe and parents safe and grandparents safe could put in mask requirements at sporting events. There's a bunch of ways to manage it where we can keep going forward. But if you also said, hey, if I'm going to, you heard Representative Pollard talk about making a choice, making a decision. Do I go in now or not? If you see an area that has got low ventilation, it's indoors, it's shoulder to shoulder, and people aren't wearing masks, something ought to go off in your head and say, hey, if I'm in a county with high positivity rate and I'm staring at at an event that's got that kind of concentration, even if it's a funeral or a wedding dance, then you might say, well, hey, if I've got risk or family members at risk, maybe I should skip this one and make a choice, because going for a walk in the country, going pheasant hunting this weekend, which I plan to do, that's a low-risk activity. You can social distance. You can be apart from people. You don't have to wear a mask. But it's, low ventilation, high crowds, loud. If it's loud noises, people talking loud, people cheering, those represent higher risk. So, again, we just have to be smart about where these transmission events are happening. And then if we apply our energy around those, we have a chance to knock it down without doing any of the things we did last spring, when we're smarter now about transmission. Okay, Jacob?
Governor, I'm not sure if you're the best person to ask for background or if one of the lawmakers are, but there was some discussion earlier today about reallocating some CARES Act dollars. I was just wondering how much we might be looking at for reallocation, if there's a certain plan on it, and if I can get some takes from lawmakers as to what they would like to see reallocated, that'd be nice.
Be happy to have them come up here, and I would say that we can certainly share, just as background, is some portion of what we've been allocated remains unallocated. We've got some dollars left of the 1.25. We've also got some that may come back, say like Bank of North Dakota programs if they're not spent. And so we anticipate that there could be another round of spending. I know what Senator Heckman suggested today, I believe it was Senator Heckman, was that there may be, or maybe Josh, can't remember, but that maybe there might be some flexibility at the federal level to allow an extension. Right now, we know that there's likely no changes coming in guidance from Congress at the federal level until after the election, whether there's going to be a fourth stimulus bill, whether there's going to be modifications. So at least from the executive branch perspective, we'd have to wait till after the election to hear whether or not we are going to be granted additional flexibility. As of right now, that I know it's been talked about, but we have nothing going other than right now the rules that Senator Wardner talked about, which is these have got to be spent and deployed by December 30th. Those are that's the law of the land as of today. Chet?
Thank you, Governor Jacob. To answer your question, until we get a better feeling as far as how many dollars are going to be coming back or that they aren't going to use, then those discussions will happen. Of course, they're going to happen in a pretty quick cycle. Now, as you know, during the last emergency commission, we did reallocate, and then at the budget section, we reallocated those dollars from the B&D because the Bank of North Dakota, when it was originally $200 million, I'll try not to go all through those numbers, but they brought back $70 million, but we did reallocate on $100 million, $50 million of that. And of that, after discussions with the Department of Human Services, with Christ, and with Superintendent Baszler, we agreed that $30 million was, I don't want to call it a bang for the buck because that's not right thing to say, but that's what we needed because the schools are under a lot of pressure. And so we thought that was more important to reallocate those dollars to our K through 12 kids. And so I see that happening again, and for staffing, mainly as well for the schools. So I see something like that happening again. And so, as I said before, when that happens, I'll guarantee you there's going to be a conference call there with all the leaders, and there will be conference calls with numerous legislators who are involved in that process, who in turn will have a conference call with Chris Jones from DHS or whoever that's going to involve, and then also there will be a conference call with the governor to talk about it, to say if that should be our mode of action.
Jacob, what I would like to add is I think the biggest thing that we could ask North Dakotans to help for is to reach out to the congressional delegation and ask for that flexibility. One of the biggest lessons I learned becoming a policymaker is we make black and white laws for a gray world. And that's the challenge we're running into with being forced to spend down $1.25 billion by a deadline of December 31st. If we were able to extend that, we could do more to invest in childcare, which we continue to see more and more closures happening throughout the state. We just got a report the other day that we've reached the highest number of capacity of kids who their childcare is closed down. We've had conversations about how do we support working families, whether it's through paid medical leave. We know that there's a number of workers, whether they're independent contractors or whatnot, that if we could have more flexibility with job service, I know our job service would be willing to provide that, but there's federal restrictions on how and when we do those things. So providing greater flexibility will allow us to find North Dakota solutions and how to invest those funds to take care of North Dakotans first. Thanks.
Danny online.
Go to Chris. Why is it okay for staff to come and go from nursing homes, but families continue to be kept away? Understand it's up to the discretion of many nursing homes, but these people are failing to thrive and need to see their families. If staff can use masks and precautions, why can't families?
Chris Jones will take that question, and Chris maybe will answer that, but more broadly talk about what we're doing on VP3 in an effort to try to stem infections in nursing homes. Thank you.
So I think specifically to answer the question, we're still learning how to best do this. As 11:30 today, CMS just released new visitation guidelines. Those visitation guidelines are a requirement that the state follow. They are more restrictive than what we currently have today. And so the team is working on how do we best work through things like you just brought up, and how do we do those based on science and based on measuring risk, not only the risk of infection, but the risk of the social emotional toll that this has taken. I think we're really lucky in North Dakota that we work with long-term care as well as we do, and we follow the rules so that we are more open than any other state as it relates to long-term care visitation. Additionally, the team is working on, with long-term care in some facilities, not only the CMS visitation guidelines, but CMS visitation guidelines take into account outdoor visitation. I think we all know outdoor visitation soon will not be something we'll be able to do in North Dakota. So to that end, we're looking at how do we create some more stale rooms, specifically with disinfectants and other things we can do, so that we can move people in and out of long-term care facilities so people can see their loved ones. I think the other thing is there was great success early on as it relates to keeping COVID out of long-term care. We're at some of the highest rates we've ever been, which is, it's really disappointing. It's disappointing, and so, but I want to look at it from a couple different layers. One is, of all of the long-term care facilities, 30% have active healthcare residents, have residents with COVID. In terms of healthcare workers, 60% of those facilities have positive healthcare workers, and this spike has started after school started. You talk to those long-term care facilities, it is coming from exactly what the governor said. So as communities, as you look at your long-term care facility and the other activities that you have going on, we know it's not conjecture, it's not anecdotal. It is coming into long-term care from football, from volleyball, and other large events such as church. That's where it's coming from. The healthcare workers are doing their job. The visitors are doing their job. It's just coming in through those healthcare workers who are doing their best, but it's the spread within the community. And that's what the communities need to be talking about. How do you want to manage that risk as a community? And that will, then you can determine the outcome of what is important. Thank you.
I want to tag on to that one of the new tools that we have coming is the rapid, highly accurate, low-cost testing. And one of the areas of priority for using those tests that we're looking at is going to be long-term care. And to Tom's question, there's the potential that you could be using those to test healthcare workers and visitors. So there is a way where we could, again, try to be a better guardian at the gate and keeping the virus out of congregate long-term facilities, because we know tragically that when it gets into one of those facilities, that's one of the ways that we can end up with a fairly rapid number of fatalities happening quickly. And so again, this is a really important matter that we're looking at, and certainly I'm sure the team, I'm just learning it as Chris spoke, that we got new CMS rules, but hey, North Dakota, every day we got something new from the federal government as we've been going through this pandemic, so this is not like a big shocker day that we've got new things we have to deal with, but our team will respond to that as quickly as we can. I'm gonna go Lane and then Jeremy.
Does the state have any statistics to show what percentage of North Dakotans are actually wearing masks, and if we have any idea of where we rank among the rest of the country in mask wearing?
I haven't seen that, Lane. Just lots of anecdotal stories and personal observation, but I would have to say that we are not where we need to be, and so and every person can count. But we'll do some digging as a team, see if there'd be great if there was an answer to that question. But even a better answer would be what would it take? What would it take for people to decide to do their part to either socially distance or wear a mask if they can't, to help make sure, and stay home if you're not feeling well? What would it take? Because we only need 2-3 weeks of that, and we could bend this curve rapidly. That's all it would take. I mean, we know the incubation cycle of this thing, 14 days. We're not asking people to do it for a lifetime. We're just saying if a community wanted to be in a real example for America, a single community could say everybody's going to wear a mask 100% of the time at all events, avoid large gatherings, and then just watch the numbers drop. I mean, that's all it takes. We know that works. Last question. Okay, Jeremy.
Governor, you've said for a couple months now that the numbers aren't moving in the right way as it pertains to COVID. At least it appears that there haven't been any major policy changes as it relates to COVID coming from your administration. I'm just wondering, what have you done to reverse this trend that's going in the wrong direction?
Well, I'd say there have been major policy changes. We've got the economy open. We've got our schools back, kids back in school. We've got our universities open, and we've managed to do all that and stay in 7% positivity range, which is an achievement compared to many other states that have never been in a spot where they've had this kind of this low of a positivity rate and their economy open. I mean, so that if you're going to say, who's doing among the states, who's doing a great job, you'd have to say those would have to be some of the criteria you'd look at is, keeping because we know about the social and emotional and the well-being, the other aspects of health that come when we can have community, when we've got kids learning, and when we've got the economy open, because we know the financial stress that can place. So we've said all along the goal was to save lives and livelihoods. The goal was to make sure we manage this in a way that we had low fatalities. And again, as tragic as all of these deaths, and every one of them, it tears at our hearts. When we take a look at other states, some other states have had as high as 8% fatality rate during the course of COVID. We're closer to 2%. We're closer to 1% for most of it. And again, when we would have to say, looking at all of that we're managing our way down a path with some very positive results. But what we need a little more of is we need a little more on the personal responsibility side, because that's what'll work. We don't need more government mandates. We need people to understand that what they do as an individual affects their community.
I'm sorry, Governor, just the way you said that. You said we've been able to have all these things open despite having only a 7% positivity rate. That positivity rate is going up. It's not going down, it's not even stagnant. It's been increasing for some time. Are you saying that 7% positivity rate is good, or that it's even going the right way?
Well, I think when we see other states that are above 10 and above 20% that are in our region where we know that there's heavy infection in the upper Midwest, then you have to take a look at the context of that and say, hey, would any of those states swap for a 7% rate? Absolutely. Well, it's been going up. The curve, as you've seen when we showed at the beginning of the presentation, has got a flat incline. I've said repeatedly, going the wrong direction. Anytime it's going up, that would constitute the wrong direction. But is it skyrocketing? No. Have we seen in some counties it going down? Have we seen some counties flattening? Yes. Have we seen some counties going up? Yeah. Then that brings the whole average together. So we have to battle this on a community by community basis, and on a net all in, we'd like to get below 5% and go, get down. I mean, that's the green zone from the White House is under 5%, but we're closer to 5 than we are to 10. And with some effort coming together in the coming weeks, North Dakota's got all the tools they need to help drive this lower.